world-class university center calls this place home. Our mission, Strong City, Baltimore, is to build and strengthen neighborhoods and people. For more than 50 years, we have shown that lasting change is achieved by supporting neighborhood leaders, fostering civic engagement, and building community. Strong City's programs and partnerships increases individuals' capacity to succeed. Today, we gather to discuss an urgent matter. COVID-19 and its variants is impacting all of us, every neighborhood and every person in Baltimore City. We must work together to save ourselves. We urge all Baltimoreans to wear a mask, get vaccinated. This is our greatest defense against this virus. Our lives depend on it. That's why Strong City and our club at Collington held a COVID-19 community vaccine clinic right here in this space. That's why we distributed more than 5,000 masks to in this neighborhood and across the city. Convened community leaders to discuss the impact of COVID on them. This is why we have pivoted our youth programming at the club at Collington, our community center, and our other services to meet the needs of community. This is why we've advocated for closing the digital divide so that we can address the issues of individuals who don't have internet access, who don't have equipment as a part of the larger issue. Strong City is excited to partner with the NAACP Baltimore branch and on the Mask Up Baltimore initiative. In addition, we are excited to deepen our relationship with one of our sponsors and supporters at Johns Hopkins University, Morgan Cares, the University of Maryland Medical Center, and our collective effort to protect the health and well-being of Baltimoreans. Again, we urge all of Baltimore to wear a mask and get vaccinated. At this time, let me introduce Joshua Harris, the Vice President of the NAACP Baltimore branch.
Good afternoon, everyone. I'm a little taller. Let me raise this mic. Tall people problems. Good afternoon. Thank you so much for joining us. And as Reggie stated, we're gathered here today. The Baltimore NAACP is happy to join all of our partners here to launch our Mask Up Baltimore, Be More Safe initiative. We're going to be rolling out. We know that COVID-19 is impacting all of us. We've seen a 500% increase in cases in Baltimore City in just the last 4 weeks. And it just spares no one. And so we want to make sure that we're doing everything possible in our power to make sure that we're keeping all of our family members, community members safe and healthy in Baltimore City. And so this is about us being more safe and making sure that even if you're vaccinated, you're still wearing your mask, that we're getting COVID tests to ensure that we're not infecting others accidentally. And so we're happy to have you join us here in the launch of this initiative. We're going to bring up our speakers. I'm going to ask the president of the Baltimore NAACP to join me here. And then, of course, the mayor of Baltimore City, Mr. Brandon Scott, to join us here, and Council President Nick Mosby as well. And they'll be our first beginning speakers. Each of them will share a little bit about the importance at this critical time and how Baltimore City can continue to navigate and keep all of our citizens safe and healthy. Thank you.
Thank you, Brother Vice President, and my thanks to Reggie Davis and Anwar Young of Strong City for hosting us today. Our thanks to the Mayor and Council President, to President Sowers of the Johns Hopkins Health System, and to all of our other partners who are here today. Today is about collaboration and about partnership. Today is about raising the level of the conversation to here so that all everyone is talking about is masking up and getting vaccinated. We have to have the strong and courageous conversations with our neighbors and our friends about the importance of getting vaccinated. People are much more likely to get vaccinated when they have these conversations with people who they know and who they trust. The good news is that the Pfizer vaccine has received full approval. It's also good news that the state school board has decided that all school systems will have a mandatory mask policy for people in their buildings. But today we also want to talk about how we inspire ourselves and those in our spheres of influence to initiate even more partnerships, to dig deeper, to find more energy, to find more resolve, to find more resources, to get the word out to the people in our communities so that we can go from hovering around 50 or 60% vaccination to high levels of 90% or more, so that we can go from having people with COVID coming and showing up in emergency rooms and back on ventilators to having emergency rooms, emergency departments available only for people who actually have emergencies. In August and September of 2021, getting COVID is no longer an emergency. We know what this disease is. We know how deadly it is. And we have to convey to people who are hesitant. I was hesitant. I'm still hesitant. But the one thing that I have clarity on is that if I get infected with COVID-19 and I'm not vaccinated, there is a very high likelihood that I'm going to end up in the hospital, that I'm going to have long-term conditions, and that I may even die. And frankly, I can't afford for any of those things to happen. I love my family too much, I love my work too much, and I love my community too much to put myself in jeopardy by failing to get vaccinated. So we have to use that lens to have this conversation. Yes, there are some concerns here, but the concerns here with COVID far outweigh the concerns with the vaccine. So with that, I want to bring up the mayor of this city, Mayor Brandon Scott, who has been a courageous leader in a very, very difficult time. He has had to face all of the challenges of inheriting a city government and all of the normal issues associated with the city, while also being a leader on the pandemic, taking hits from the virus itself, but also from less forward-thinking leaders who don't want to see him do the right thing for Baltimore. I'm so very proud of this team, of the council president and the mayor, and their decision to move forward with a mask mandate. We support this leadership, and we support the things that they are doing to keep this city safe from COVID-19. Mr. Mayor.
Thank you. I am not as tall as the Vice President and the President. And thank you, Mr. President. Thank you, Mr. Vice President, and to the Baltimore branch of the NAACP for being a leader throughout this pandemic and being innovative in how we get the message out to our community about how serious COVID is and what the impacts is and have and will continue to be on our community if we do not do the right thing. I am honored to be here today with my partner, Council President Nick Mosby, my State Senator Corey Mccray, my State Delegate Stephanie Smith, our wonderful hospital partners, and I think, Mr. President, you also achieved a feat with this today. We have West Baltimore community leaders in East Baltimore today because we know how important this topic is. And I want to remind everyone and everyone that hears this and sees this that COVID is not over. We are still in the midst of a global pandemic. We know that the Delta variant is a mutation of COVID-19, but it is not, I'm going to say it again, it is not the same virus we have been battling all along. It is more transmittable and more deadly to unvaccinated individuals. While we are making progress, the Delta variant has made it clear that until we get everyone vaccinated, Mr. President, COVID-19 will remain unpredictable and dangerous to our communities. It is of the utmost importance that we continue to wear masks indoors and do everything we can do to encourage our neighbors, friends, and loved ones, lottie-dottie and everybody, as our great Congressman Elijah Cummings would say, who haven't been vaccinated to get vaccinated. And yes, we want to get people's questions asked. Ask your questions. Do your research. But let me just go aside for a second and do your real research. Don't go to sources of folks who are not reliable. Don't go to musicians who, for example, Teddy Riley, who have trouble working musician equipment, and ask him about a virus. Talk to people who understand, medical professionals, your doctors. We have to understand how serious this is. This is so serious that you cannot just go off an Instagram post or a viral video or something that someone sent to you. You have to understand that this virus is killing people, and it's killing people in our community, in the black community more specifically, Mr. President, that would force us and has to force us to raise that level of seriousness of how we treat this. People will continue to die if people don't get vaccinated. It's that simple. Think about your parents. Think about all the people we've lost to COVID-19 in Baltimore alone. I often say to folks, we know, we talk about in Baltimore consistently how many people we lose to gun violence, right? But think about that we've been losing more to COVID. And think about how serious that should make this issue to folks to saying, what can I do to not end up like that? What can I do to not have my parent, my grandparent, my neighbor, someone that I know end up as one of those people? You can do it by just simply getting vaccinated. Don't just do it for you, do it for those around you. Do it for our young people so that they can go back to school and learn in person and be social and do the things that we know we need them to do in order to grow into the best version of themselves. Our Health Commissioner, Dr. Zaraza, has been working tirelessly along with our hospital partners and others to make sure that we are, Mr. President, following the data, the science, and doing what we can do to get folks vaccinated. We have been engaging credible messengers and sending them out into our community. We've been going to where people we know need to be vaccinated and doing our pop-up vaccination clinics like the one that Collington Club did here, because that's how we have to do it. And yes, we have come under fire, Mr. President, for leading and doing the right thing and not the popular one when it comes to COVID. And when you think about that, even though we've had a 374% rise in COVID-19 over the past 4 weeks, and our positivity rate has also risen 228% to 3.3%, that is still the lowest in the state. And we know because we have been telling our neighbors, our residents have been wearing masks, they've been following the protocol, and this is why we're here. We are here to save lives. We know the cases will increase if we do not continue to do that and get people vaccinated. So I want to be very clear that we will get you vaccinated. This is no longer a conversation about if we have enough. So if you need a vaccination in Baltimore, just simply visit covax.baltimorecity.gov. That's covax.baltimorecity.gov. We will continue to follow the guidelines. We will continue to talk to any and everybody about how they feel about this vaccine, but we will also continue to challenge people. We will also continue to push them to think outside of what they're comfortable with and understand that this is about saving lives so that we can put COVID to bed once and for all. So thank you, Mr. President. We look forward to continuing a partnership with the NAACP and everybody across the city, because it truly is Baltimore versus COVID, and we're going to win it together. Thank you.
Thank you so much, Mr. Mayor. Next, we will hear from Council President Nick Mosby, immediately followed by Kevin Sowers, President of Johns Hopkins Health Systems. So, Council President Mosby.
The NAACP has led on the equity issues related to this pandemic from day one. But it was Delegate Nick Mosby who did the important work to start getting the reporting on the testing about who was getting infected from COVID and forcing the state to acknowledge that there are racial disparities in terms of how black people are treated when they encounter the health system. So we applaud you for that great work, Council President, and we thank you for continuing to do great work.
No, thank you. Thank you, President Little. Good morning, everyone. All right, so President Little and Vice President Harris did everything right today except one thing. They forgot to turn on the air conditioner. Because, boy, it's hot up back there in that sun. You guys are in the shade, but it's hot out here. Like President Little said, Baltimore was a leader. We were a leader as it relates to calling out and disaggregating the data to understand and know and pinpoint and target where we needed to go and where this virus was affecting folks and where folks needed to be tested. We were a leader. Like, there's no doubt about that. We did it in the State House, enforcing the state of Maryland to start releasing the data based off of racial and zip codes. We were a leader there. We've been a leader as it relates to developing innovative ways in this city, and the stats that our mayor pointed out showing that Baltimore City, as it relates to other cities with similar characteristics from a socioeconomics perspective, similar health outcomes and indicators, a similar size, that Baltimore City has been on pace to be literally one of the best. I remember being interviewed by a national NBC syndicate, and they said that Baltimore was the next hot spot. Do you remember that last year in 2020? That never occurred, right? So we've done that. We've done those things right. But we have not done enough. I mean, we're here today to say be more safe and mask up, because we understand and know that the transmitting of the Delta variant is 200 times more dangerous than it was during COVID-19. And on the heels of sending our young folks back to school, on the heels of social media constantly putting out this narrative that normalization is here and we do not have to wear masks, right now is a pivotal time for each and every one of us. Today represents an opportunity for us to collectively come together and again be the leader of this country and say we must do more to fight back this virus. It's time for us to put this dark chapter in our history to pass. And the only way we will do it, is going into our communities, talking to our loved ones, talking at church, and letting folks know that this hesitancy thing must go away. That the vaccination is the key to us driving this down and us truly getting back to normal. When I talk to folks, I ask them two things. Do you know someone or know of someone who's died or been seriously ill based off of COVID-19? That's the first question I ask. And normally 9 out of 10 folks tell me yes. My next question is, do you know of someone or do you know of someone that has either died or been seriously harmed by wearing a mask? Let's think about that. So we talk about our uncomfortability, and my wife, Marilyn, will tell you sometimes she wears certain heels that are uncomfortable. So we can wear a mask. Sometimes to the fellas, you want to be in that tight, personalized, tailored suit, and you want to sit down at the table, Reverend, right? That could be a little uncomfortable, right? But you're telling me something, knowing the severity of what this virus has done for the past 18 months to places like Baltimore City, all across the country. You see the numbers. Your excuse is that the mask is uncomfortable? Be more. Be safe. Be more safe. Mask up. It's simple. And then we can ask that same question to folks who enjoy to go to Instagram or Facebook to get an ingestion of their medical advice. President Sowers. I asked them the same question. How many folks have you known that have taken the vaccination that are no longer with us or severely ill by it? And the answer is always 0. It's simple. It's as simple as that. Mask up, get vaccinated, and let's get out of this thing, Baltimore. Again, it's important for us to collectively come together and for Baltimore City to be the leader of it. I was excited when Reverend Little called me and he saw the work that we were doing with the Maryland state government to start releasing of that data. And he was there from day one, and he's still here today, and it's for us to continue to stay together. So again, thank you to everybody for coming together, our partners in the medical community, our partners of the National Association for the Advancement of Colored People, our mayor and all his tireless leadership, and each and every one of you for continuing to push this narrative and showing that Baltimore City will set the pace. We will continue to drive this thing down, and we will be back to normal one day.
President Sowers. And now we'll hear from President Kevin Sowers, President of Johns Hopkins Medical Health Systems. And then Dr. Sidnor, can you join us as well as Anwar? You all will be next.
So as as President Sowers comes to the podium, I want everybody to know that when the NAACP rolled out the Mobile Public Health Education Unit last April, it was the strong and silent support of Johns Hopkins Health System that made that happen. We reached out to Sister Hitchcock, and she talked to President Sowers and to Dr. Golden, and they provided the resources for us to take this important message to the parts of our community that weren't getting the message from the news media. And so I want to say thank you to you, President Sowers, and I want to let everyone know that we're going to continue to operate the Mobile Public Health Education Unit and to direct people in our community to the vaccination sites that are provided by providers all across the city, including the Baltimore City Health Department. If you need to get vaccinated, you can call this number right here. Everybody here, news media, take it down, run it across your chyron. Friends, write the number down, 410-955-1062. You can call that number and they'll tell you where you can go to get vaccinated. President Sowers, thank you.
Thank you much, President Little. You are a hard act to follow, I've learned. But I do want to thank you and the NAACP leadership, to the mayor, to the president, to the city council. I really want to thank you for the partnership that we've had in serving our community. I also want to give a shout out to the University of Maryland and Dr. Mohan Santha. Hopkins and the University of Maryland have come together as partners with the city to really serve the citizens in a meaningful way, and so I appreciate that. And to our state delegates, I also appreciate the support that we've received from the state. I'm pleased to join you here today, and it's a pleasure to be here to specifically talk about the health and safety and well-being of the people of Baltimore. You know, the last 18 months has been a difficult time for all of us, but Johns Hopkins Medicine was created to serve as a resource for our community. And as I was thinking about my remarks today, I found a quote from Dr. Martin Luther King that I want to remind us of. He said that we are caught in an inescapable network of mutuality, tied to a single garment of destiny. And when I reflect upon that, in this way, what impacts one of us or one part of our community impacts all of us and our entire community. We are one Baltimore. Each of our actions impacts our neighbors and our other families' lives. Throughout the pandemic over the last 18 months, the teams at Johns Hopkins Medicine has been critically important for us to be a collaborative partner. And it's been an honor to work alongside the city, with Dr. DeRaza at the health department and local NAACP leaders on numerous efforts aimed at providing resources and educations to protect public health. Our health equity initiatives have included those aimed at addressing the disproportionate impact of the pandemic on communities of color. We've provided mobile testing sites in hard-hit areas. We've partnered with the NAACP on culturally competent educational campaigns. We've also worked alongside teams from the health department here in Baltimore and in Washington, D.C. to go out and meet our seniors and vulnerable populations where they live, breaking down barriers that can often delay people's access to vaccination. It's our responsibility to serve the community and to protect the vulnerable populations and to take care of each other. You know, I was rounding yesterday, and I've spent the week rounding in all of our hospitals in Maryland and in Washington, D.C. And I'm going to break away from the script to tell you a story. So yesterday I was in one of our hospitals, and I went into a patient's room who had just been recently diagnosed with COVID, and he was unvaccinated. And I was in the room talking about him and where he was with his health condition at the time, and he's in serious condition. And I said to him, "What made you not get the vaccine?" And his response was important. He said, "I was stupid and I listened to the wrong people. And because of that, I may now die." That story is impactful for me because it's reminding that it's not just, as Nick said, it's not just the importance of giving people the science, but it's connecting the heart and the head so that people understand the long-term impacts this could have on their lives. And so that is an important part of the lesson that I was reminded of yesterday. Currently, 99% of the patients that we are caring for in our hospitals are people who are unvaccinated. And so that should be very telling about why we're here today, joining alongside leaders in the community to share the important message. I'm not going to encourage people anymore. I'm going to ask people to mask up and get vaccinated. It's past the time of just trying to encourage people. It's a requirement if we want to survive this pandemic. Because we all know that the cases of hospitalizations, as you've heard today, are on the rise, not only in Baltimore, but across this great nation. But this is a time in the life of the pandemic that the Delta variant makes it different. The Delta variant is a much more virulent virus than the other ones we saw in the prior surge. And so it's even more important that we decrease the impact on our hospitals. I need to remind you that our doctors, nurses, all of our team have been tirelessly working over the last 18 months to care for people with COVID. They're tired. If you look at the other parts where people have not vaccinated, their healthcare workers are getting really tired and really struggling with continuing to care for the citizens in their community. We do have the data that shows that wearing masks does make a difference. We also have data that shows that the vaccines are safe and effective, and one has been approved by the FDA. And it can actually prevent people from being hospitalized and from dying. So I'm here as a community partner to ask you to mask up and get vaccinated. The vaccine is safe and it is effective. I encourage also all of our local businesses in Baltimore to continue to get involved in this message and to continue to set the expectations within their own businesses and with their own employees to mask up and get vaccinated. We want to continue to be able to support our local businesses. Baltimore, it's up to you for us to protect each other for our community and for our future. Thank you very much.
We're here to be more safe, mask up Baltimore. And with that, we're actually going to hear from next Dr. Kim Sitnor, who's the Dean of Morgan State University's School of Community Health and Policy. Dr. Sitnor.
Good morning, everyone. If it's still morning, I am on the shorter side, so I'm pulling the mic down for you tall guys. It is really a privilege to be among this august group of people. Reverend Little, really thank you so much, and the NAACP, for including Morgan State University, the Eastside University, HBCU, and shout out to Coppin, I know you're in the room, recognizing the importance of our institutions in this fight against COVID. The most exciting thing about the call was Reverend Little said he wanted us to come out as collaborators and partners. And when I hear that language of collaboration and partnership, I wake up immediately. It is a thing that gets me going each and every day. And to see the number of people who are gathered here on a common mission makes me excited and happy. I was even more thrilled when I got here and met some of my colleagues, and we started connecting with the University of Maryland and Reggie Davis at Strong City, and already we're making plans to do more things for the community of Baltimore City. I am a native Baltimorean, family born and bred here, have deep roots in here. My father was a minister. I'm not going to give you 15 minutes. Shout out to Reverend Howard, who was one of my father's good friends from Enon Baptist Church, who's here in the audience. So it is all about collaboration. It is all about taking care of each other. Morgan has several projects going on relative to COVID. I'm not going to go into detail for each one of them. There is one with Value Baltimore linking us with Baltimore City Health Department, with Johns Hopkins, and with Micah and the health ambassadors. I do want to give a shout out to those ambassadors because they are the ones out there every day amongst people who are both vaccinated and unvaccinated, making sure the message gets out to vaccinate and mask, understanding how critical that is. So I wanted to make sure I said two things before I left this mic today. The first is there is no war against unvaccinated. Let's really be clear about what we're doing. It is we're bringing all of us into the fold to make sure we're all taken care of because we are all in this together. So please, as you engage those who are unvaccinated, it is about communication, it is about conversation, it is about understanding why they have not yet vaccinated and doing all we can do to help them make that most appropriate and necessary decision to get this done. But be clear, we are all in this together. And then the second thing I wanted to say is we in the public health sector have a responsibility for why we're here this moment. We have lacked in our trust and credibility with community. We need to own it, acknowledge it, and make sure that when COVID is over, that we don't leave. I know the city is already making plans to continue in communities to continue this work, but every institution here who says we're in this fight, we have to stay in the fight the rest of the way, because this will not be the last crisis. This will not be the last pandemic, and we need to be better prepared the next time around. We have lessons learned, learn them. We need the evidence that we've learned them like the good students that we should be, and be out here and be a collective group from this point going forward. And so in closing, I just want to bring forward one of our members from Morgan State University, Dr. Payam Shakatari, who's director of Morgan Cares. Morgan Cares is one of the residents here in the beautiful Hohen building. And Payam, you told me how beautiful it was, but now I know I'm going to have to get an office up in here. But I really want to give him a chance to come and talk about the work they're doing with the community as well. But really, thank you again, Reverend Little, NAACP, all the folks here for all the work we're doing. It makes me so happy for the city of Baltimore, have the leadership of the mayor, city council in this effort. Thank you.
As Dr. Secretary comes, I do want to say that we are proud of the history of Reverend Dobson, and we are proud of the civil rights leadership and advocacy, and we're super happy to see that show up at the School of Community Health and Policy as they develop their Center for Health Equity, and we look forward to those collaborations as well. Thank you, Dr. Sidnor.
Good morning, everyone. It's a great honor and pleasure to be here. Thank you, Dr. Sidnor, for that kind introduction. Morgan Cares is a center committed to promote health equity in the city of Baltimore and the state of Maryland. And the way that we do it is through bridging an important gap between data, policy, and practice. And we do that by forming or assisting in formation of trusting relationship between the community leaders and university researchers. We believe that a lot of good community-owned projects are conducted without sufficient input or collaboration between the academic community. And that's what in Morgan Cares we try to bridge that gap by generating data, research data, and translating that evidence into practices in a way that also generate actions needed to address the problems. As a result of pandemic, we have been able to bring in number of projects into Morgan Cares network. I would like to just highlight some of them. We are now part of a national consortium called Community Engaged Alliance, SEAL, to reduce vaccine hesitancy and encourage participation in research. And this is something that requires a holistic approach. We have also been able to afford the opportunity to evaluate the COVID response in Baltimore and to make strong recommendations based on community-driven feedback to influence policy decisions that impact us now and in the future. Speaking of the future, we have a center, part of our network, Center for the Study of Religion and the City, that has just begun their Good Life project, their collective narratives from the community to document all the positive lessons that they have learned and try to incorporate that into a brighter future so we don't go back to the old normal, we come out stronger. And this is really important, and I would like to end my remarks by saying this: creating this kind of momentum required education, it requires grassroots action, and none of this can happen with strong leaderships of organizations such as NAACP and also Strong City and the community leaders and faith-based groups. So we thank everyone. We especially thank the Center for Neighborhood Innovation for creating such an interesting momentum by renovating this beautiful historic place that holds so much. And we are so honored to be a tenant, and thank you.
So the next three people that you all will hear from are extremely critical to the work that we're doing when we talk about Be More Safe and Masking Up Baltimore. Because if we aren't able to reach people where they are and meet them on the ground in the communities, our messaging is ineffective. And so I'd like to ask Shia Parker to come join us, as well as Yolanda Jiggets to come join us. Our next three speakers are actually our partners on the ground who help us to reach the community, have helped us with mass distribution over the last year, and has helped us with messaging to ensure we're meeting people where they are and making sure that they are able to have all the information necessary to stay safe and healthy. And so first I'd like to welcome up Anwar Young, who's the board chair of Strong City, where we're here today.
Good morning, everyone. I know it's a hot day, so I'll try to be brief. But thank you all for being here. The subject that we're discussing is very sobering, so there's no time for laughter, but there's time for work. So first I want to say thank you to Reverend Little for your leadership, for spearheading this alliance, and for the opportunity just to continue the partnership with the Baltimore branch of the NAACP. Strong City and the NAACP have over the past year done some incredible work in service to our community, I should say, and we look forward to continuing just that. We value the collaboration and are excited to work in consortium with each of the elected officials in attendance today, the organizations and institutions also here today, and we want to work together collectively to strengthen and resolve and create a response to this COVID-19 epidemic. Regardless of the nature of our work, we share one thing in common, and is that we have a common cause and calling to serve. At Strong City, Baltimore, as Reggie already mentioned, our core mission is to build and strengthen neighborhoods and people. We've done a number of things here at the home building, but our history goes back much farther, 50 years of contributing positively to our community. I want to say this because I think it oftentimes gets overlooked. Our greatest resource isn't this building. Our greatest resource isn't the vehicles that we have in our fleet. Our greatest resource is the people of Baltimore. And it is our hope that collectively we will find a way to defeat this deadly and destructive virus. COVID-19 is the plague of our lifetime. Its impact is pervasive, touching every community and leaving a trail of unspeakable tragedy in its midst. Each of us here has encountered it in one way or another, whether it be through our personal interaction, through a family member, a friend, or a colleague. The work that we put forth here is essential to defeating the disease. But we must also work collaboratively to come up with ideas on how to message the information that is within our disposal. We have to touch communities that oftentimes get overlooked. We have to actively attack vaccine hesitancy, misinformation. The availability of PPE is no longer a concern as it was in the early days and weeks of the pandemic. Vaccines are widely accessible at this point. These are certainly important weapons to wield in this fight. Even the most powerful weapon is ineffective if you don't know how to use it properly. Education is our key to winning this war. We invite dialogue and partnership with all community advocates in efforts to more effectively empower our neighborhoods with resources, reliable information, and the motivation needed to combat this common enemy. There is no us or them in this fight, just we. But I believe we are up to the task to decisively win this war if we are united in our purpose and focused in our efforts. We must appeal to our collective identity as citizens of Baltimore City and fervently commit to a more inclusive response to COVID-19. A better Baltimore stands on the other side of this pandemic. Let's get there together. The facts are clear. The evidence is sound. Wearing masks works. Vaccines work. We must not leave the health of our community to chance. When viewed through this prism, the answer is clear. Mask up, Baltimore. Please get vaccinated. Thank you.
Thank you, and we'll hear next from Shia Parker, Executive Director of No Boundaries Coalition.
Good morning, everyone. It is a pleasure to be here today. I've worked with the NAACP for over a year, making sure that my communities have information about vaccinations and also have ample access to masks. So my organization serves 7 neighborhoods in Central West Baltimore. If you were to drive through those neighborhoods today, you would see people who are moving about like we are not in a pandemic. So we still have a lot of work to do to ensure that people are wearing masks and that they have the confidence in getting vaccinated. There's another population that I would like to highlight today. A lot of residents in my neighborhoods who work at the grocery store, at McDonald's, at places that we usually did not consider these folks to be heroes, are now the heroes. They could not work from home, they could not work from Zoom. They had to go to work every day. A lot of those folks were exposed, and a lot of those folks brought COVID back to their homes. So again, we have to protect everyone in our communities, all of our vulnerable populations. I'm here as a leader that will continue to pass out masks, continue to host vaccinations. I look forward to the partnerships of all that are here today, and thank you.
I want to thank Shia Parker from No Boundaries Coalition. They do outstanding work. I'm not going to take away from other groups, but all of the great things that you see up and down Pennsylvania Avenue, Upton neighborhood, it's because of the great work that No Boundaries Coalition is doing. So please, please, please support No Boundaries Coalition. They are on the street doing the work at the level where the rubber meets the road. Thank you, Shia. Next, I want to bring up a hidden treasure in Baltimore. Sister Yolanda Jiggets is the executive director of the Park Heights Renaissance Organization, and they are leading an effort to renew the Park Heights community. I have found this sister to be incredibly insightful, and we have worked together on Get Out the Vote, and we're looking forward to continuing to work together on distributing masks and all of the other great work. Sister Jiggets.
Thank you for those kind words. Good morning, everyone. Good morning. First of all, I just want to say I'm encouraged to be here with leaders and colleagues from across the city. This is what true collaboration is about, and it makes me excited. East side, west side, north side, it doesn't matter. We're in a pandemic, and I think that we have lost sight of that. And so I'm excited to be here today because at the grassroots level, at the community level, we are seeing the impacts day to day, and we need help. And so we're happy to be here today to strengthen those partnerships that we already have. But we must acknowledge, and Dr. Sidnor took my points, and I just want to restate, there are reasons that many are skeptical about getting vaccines based on the history. So we have to acknowledge that first and foremost, and we have to do more to get the education component out from trusted sources. So I look forward to the continued partnership because now is a vital time for us all in community development efforts across the city. We don't have time not to be able to socialize. We don't have time not to have in-person meetings. This is a critical time that we need to come together across Baltimore City. And so I encourage everyone here, everyone in Park Heights, I want to give a shout out to, please mask up. It's important. We want to socialize. We want to get back to hugging and loving in a way that we are used to. So thank you all again. Tomorrow in Park Heights, we're having a back to school end of summer session. Please come out. Park West Medical will be there also giving out vaccines. And in September, we'll also be giving out vaccines at our Safe Streets summer event on September the 11th. So there are many opportunities to get vaccinated in addition to all the great information you've heard today. So thank you all. Look forward to being a part of this effort.
Next, we'll hear from Dr. Niharika Khanna, professor at the University of Maryland, Baltimore, School of Medicine, and then immediately followed by Senator Corey Mccray and Delegate Stephanie Smith.
Good morning, everybody. I want to say a big thank you to the NAACP and their leadership for inviting me. I want to say a big thank you to all the dignitaries in the room, and thank you all for being here to elevate our discourse. I come to you as a family physician who has worked in Baltimore for the last 31 years, and primarily in West Baltimore. And when COVID started, the pandemic started on March the 12th of 2020, I realized there was a lot of work to be done. And it had to be from the grassroots that we recognize where COVID really occurred. And so we started collecting data on everyone who was being tested in our 4 clinic jurisdiction that we had. And we quickly realized that the disease was in the poorest of our socioeconomic demographics all around Baltimore. And that got us thinking that there had to be a different dialogue with people on how to stop the COVID from spreading. It didn't need to be the same as everybody else. It needed to be specific to our audience. I'll fast forward with that data gathering and understanding where the disease was, advising CRISP on utilizing socioeconomic demographics in zip codes in particular to map who was getting sick, what was the racial and other ethnic demographics of these people, and how to bring services to them. So that led us to writing a few grants to the state, which we're very thankful. They gave us a lot of money to go out into the West Baltimore community. I had the immense honor to meet the Black Mental Health Alliance, the Black Muslim Alliance. We talked to youth groups. We were talking with Heart Smiles and a whole host of other people in Baltimore City when we realized that we needed a bigger platform. We had to develop a community workforce in order to really get to our communities. And that's where our partnership with the NAACP starts. We wrote a grant to HRSA, and they were very generous. They funded us for a 4-state area, and they told us, replicate what you're doing in Baltimore, which was a matter of great pride for us. And what we are trying to do is to take people from the communities in which they live, to train them, to teach them what is COVID, what is the vaccine, why should you be tested, why is this relevant to you, what does masking mean, what does it do? Are we just asking you to cover your face, or are we asking you to cut the spread of COVID into your own families, your own communities, your neighbors? Our children are going to school. We don't want them to be running up and down with COVID. They take it there, they bring it back. We certainly don't want to see that. In addition, with the advent of the Delta variants, and Reverend Little has been really forward in putting together public forums where we've had a chance to talk about the Delta variant and how very infectious it is. As a physician, I can tell you that if I see one patient of COVID in the past and they were infecting 2, I knew my workload was going to double. But now with Delta, it's going to be 5 or 6 people. So it's going to be 6 times the number of people. So we all need to be thinking, do we want this virus to keep percolating in our communities? Or do we want to just cut this virus in its tracks and then get us back to normal as quickly as we can? Our HRSA grant has allowed us to get a lot of technical assistance from the federal government, a lot of resources. We've had a chance to have Wednesday meetings where we bring together our partnerships with the NAACP, the AME Zion Church, the federations that represent families of underprivileged children. We've got the community behavioral health group that takes care of people who have been in penitentiaries and are reintegrating into society with multiple behavioral issues. We're trying to get to pregnant teens. We're really trying to make an effort, and we really, really appreciate all of you being here and elevating our discourse to the next level and helping us get the message out to the community to get tested when you're in contact with anybody or you have symptoms. If the vaccine is something you're considering, talk to your doctor. We're available. We've got a dial a doctor hotline that you can call. I like to be called. You'll probably get my contact information, I hope. And we really want to answer those questions for you. We want to make sure that you are comfortable when you go and get the vaccine. It's a series. Remember, it's 2. The 3rd one has just gotten announced. We have 1 that's FDA approved. And I think we are in a very good place to tell you that the vaccine is safe, it's effective, it's right for most people. There are a few people for whom it's not going to be right. Talk to your doctor and make it happen for yourself, your family, your community, and let's do this together. Thank you all.
Thank you, Dr. Connell. We are very working together and have had some very fruitful developments, and we've through working with Dr. Khanna have been able to develop other partnerships and relationships with other organizations. So we're grateful for all of the universities in Baltimore stepping up to the plate. Thank you, Dr. Khanna. Please bear with us. We don't have any lightweight speakers. All of our speakers today have important messages, and we are live streaming on Facebook. So we want to get all of this in the record, because what one person has to say may not resonate with one group, but everybody here has something to say that will resonate with somebody. We have 2 outstanding legislators here, the chairs of our Senate and House delegation. And at this time, we'd like to invite Senator Corey Mccray to come forward and address us.
Thank you, Reverend Little. Thank you, Mr. Vice President Harris. I just want to say first I'm honored to be able to be joined here with you all. Mr. Mayor, my council president, Strong City Baltimore, all of my leaders, my delegate, my community leaders, I'm just glad to be able to be joined here with you today. Our medical institutions, Hopkins and University of Maryland, I'm glad to be joined here with you today. And I just want to say that there are a couple messages that resonated with me. When Reverend Little talked about faith, and he talked about trust, it hit me. And I said, he getting there. And then Dr. Sidnor came up and said it very eloquently about faith and trust. But Dr. Sidnor, I want to put it where they can get it, because I think they heard you, but I'm not sure if they heard you when they talked about faith and trust in our communities. So the reality is that we're talking to the hard-to-reach population. We're talking to the hard-to-reach neighborhoods. We're talking to the hard-to-reach zip codes. And the reality is that historically, that trust has been broken because the illegal dumping has been sitting in their alley for too long. The abandoned houses have stacked up and collectively been too hard to handle. Their young people haven't been able to matriculate in the manner that they believe that they deserve. There are so many issues that are in front of us. There are so many issues that are in front of us. But when we serve those issues with urgency, we can deal with our vaccine. We can deal with the masking. And for folks that may not know what neighborhoods that I'm talking about Dolly Park. I'm talking about South Clifton Park, right up the street there in Berea. These are the hard-to-reach neighborhoods. The reality is that we need trusted validators, Shia. We need trusted validators, because the people that are right there, they talking about, like, hey, I need the physician. A lot of them don't have health care, Ms. Jean. They don't have health care because it's unaffordable. And how can they get to a physician if they have not seen a doctor in 5 or 10 years? So we're talking about that hard-to-reach population. We need our trusted validators. As I look in this crowd, Kobe, I'm glad that you have a Shia Park, because I know the work that she's doing with our young people right up and down Pennsylvania and Lawrence. I know the obstacles that our young people face each and every day that they go to school, when they go to recreation, and everything that they're trying their best to be successful, so I say thank you. On the east side of Baltimore City, we got Miss Vanessa, y'all. And if y'all ain't heard of Miss Vanessa, y'all need to learn about the Club of Colleton. Y'all need to learn about the Club of Colleton, because she's wrapping her arms around these young babies and she's letting them know that they love them. So when we talk about these trusted validators, while their alley may not be cleaned up, while their health insurance may be unaffordable, these are the people that's in the neighborhoods doing the work, and that's how we're going to get it done. To my friends and family, I said a yes. I too was apprehensive. I too grew up in the same neighborhoods and seen the same conditions, but I got there. You want to know why I got there? Because the hard conversations have to happen. Have a conversation about my kids being out of school. I'm going to get vaccinated. Have a conversation about how me and my wife, Nick, are going to do child care. You know what? I'm going to get vaccinated. have these hard conversations about employers that are starting to mandate for the right reasons. I'm going to have that conversation. So while I might not be talking to everybody, I'm talking to the folks in my neighborhood. I'm talking to the folks.
Keep talking. You're talking right.
I'm talking to the folks that I see each and every day that are in my family, that are on the blocks that I go to, my barber, everybody that's right there in my vicinity, because I know why they're apprehensive. But I'm also here today to say that I'm glad to stand by each and every one of these leaders. I'm glad to stand by my delegate. I'm glad to stand by my mayor. I'm glad to stand by my council president. I'm glad to stand behind my medical institutions, because I know that they have the sense of urgency. I know that they're addressing food insecurity. I know that they're addressing broadband. I know that they're addressing the serious issues that face our neighborhood. So I'll center it and come back where we need to belong. The social issues are the reason why the vaccinations aren't high in our hard-to-reach population. But each and every one of you are here today because we are the validators. We are the ones that can get to our community. I say thank you. I salute you. I lift you up. And let's have this conversation in the neighborhood. Thank you again.
That's my senator. Y'all heard that? Again, Stephanie Smith. First, I didn't get a chance to welcome you to the 45th District. This is the district we represent, so welcome. But I just want to have 3 points. First, to the people that are here, I've heard a lot of people say they're excited about the collaboration. I too am excited about collaboration. But one of the things we need to think about, and this is echoing what he's talking about, it's social and economic isolation that gave rise to a lot of the hesitancy we're talking about. So this collaboration cannot just be even just in the public health context. It has to be across the city. Every answer to every problem in this city is in the city, in a silo, by itself, trying to work it out. And that is not how we're going to solve the problems our city faces. For the people that are watching me on Facebook, particularly for our black residents, because I've been black all my life, so this is the perspective I'm coming from. When you are living in a country that has been founded, baptized, and has conducted itself upholding white supremacy, you are always trying to find a way to bob and weave and get out of its way. It's something that's ever present. You're always trying to minimize the long arm of white supremacy over your life. I just want to submit, after hearing what the council president gave as really useful questions for us to ask our loved ones and neighbors, let's not overcorrect to the point we put ourselves in the bullseye. We want to make sure that we're alive to be here for our families and for our communities. So I just want to say that I understand the paranoia. I understand the concern, because how can you be in a country that has oppressed people that look like you for 400 years and not be a little hesitant or a little concerned about the messaging? That's not irrational, but we can't ignore that irrationality. We have to meet it with the messengers that people trust. And we also can't dance around things. So that's why I'm really grateful for Dr. Sidnor's messaging earlier. We all have to do better. And that means that we can't just be here for this fight. We got to be here for all the things my senator mentioned that will be here after this pandemic leaves us. There will still be challenges around crime, grime, and all the other things that make people's lives, matter. And the last thing I want to say, for all of those who are vaccinated, and as we've heard, these masks aren't always the most comfortable things to do. I know I have some ministers in my midst. Do not be weary in your well-doing, because it's not in vain. We need you to stay the course. We cannot do it. What do they say? If you solve half of a problem, you still have a problem. So we can't just be tired of this pandemic because it's not tired of us. We have to do the things that we can do to protect ourselves, and most specifically to protect our children who do not have a vaccine available to them. My children are 7 and 2. They don't have an option. So for adults, if we say we want to show that we love our kids, I'm glad a lot of them are walking into brand new schools this year, but they should be going home to adults that love them enough to protect them and to get vaccinated and stay masked up. So that's my message. That's my TED Talk for today, and I wish you all well.
Wow, 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 wow. Those are the chairs of our House and Senate delegation. Great leadership. Thank you, Delegate Smith and Senator Mccray. The Bank of America could not be here with us today. Janet Curry is the regional president for Maryland, Delaware, and the D.C. metro area. She could not be here with us today, but they are the sponsors of these masks. They paid for these masks. They were intentional about reaching out to us to hire black makers to make these masks, and it is these partnerships. There is no surviving the pandemic if we're not putting food on the table. And we can't put food on the table if everyone doesn't get a paycheck. And so that's why it's really important for all of us to lean in, whether it's the provision of fresh produce that Hopkins is doing, or it's hiring black contractors, or it is encouraging people in other ways to make sure that they are able to make their ends meet. It's very important. We do have 2 more sets of speakers who are going to provide important messaging. Glad to see the leaders of our faith community here, as well as business leaders. Josh, you want to bring up the next speakers?
Yeah, the next person we're going to hear from has been a staple in the Baltimore City business community for a long time, and we know that it must be business and community working in collaboration to keep our community safe and healthy. So, Mr. Bill Struber, would you like to come up and bring a few words, say a few words?
Thank you. So 2 quick things. One is I want to welcome everybody to the Center for Neighborhood Innovation at Home Lithograph. It was a delight yesterday afternoon to spend an hour with my fellow master electrician, Senator Corey Mccray, touring around. I went to Jumpstart and talked about the 3 new classes in person this fall that we hope to launch with Penn Station Construction, Perkins Homes in the Choice neighborhood, and one right here on Biddle Street, a new housing rehab training program. ABC brought in all their apprenticeship programs around Maryland here, committing to triple the number of building trades apprentices living in Baltimore City. And nothing better than that partnership. Then we went upstairs with Trevor Price, probably the fastest growing black-owned business, amazing Outlook Animation Studio. He said Nickelodeon, Netflix, Disney, they're all trying to get him to go to Hollywood. And he said, I want Hollywood to come here. We're going to have Burbank East right here in Baltimore. 65 people he's got working, 200 by next year, going like mad. Then we went down and met Payham at the Morgan Cares program, talking about partnership, Strong City, Baltimore. That's what the CNI is all about. My message to my friends in the business community, we're all anxious to get back to work full throttle. We want to be in person. We want to have people in our businesses. We want to be going. And there's no better opportunity than today. I've been 47 years working in Baltimore. This is the most federal resources coming to our city to rebuild our neighborhoods, rebuild our economy, all of Baltimore. So business, this is the time to do it. So I say to my fellow business folks, mask up, backs up. We can get rid of these and get back to business and create a shared prosperity across all Baltimore. So thank you, Mayor, and everybody for your leadership. Business, we're in.
Thank you. Thank you. Listen, we're here at Strong City. We're making an investment in this organization, in this community. We're delighted to have Councilwoman Shannon Sneed representing Senator Chris Van Hollen, who offered a statement in our release. We're very happy to have Ms. Terry Freeman, the president of the Lewis Museum, here with us. And I see we have a couple of other partners. We have Reverend Arnold Howard representing the Maryland Health Equity Alliance. We have Dr. Boyer Freeman representing the African American Clergy Medical Research Initiative. And I want to ask Brother Tyrone Roper from the Community Engagement Center to come up. And I see Pastor Milton Williams from the Pennsylvania Avenue AME Zion Church is here as well. We are delighted to have our faith leadership here as well. So this Tyrone is our last speaker. I don't think I've left anybody out. But he's going to talk a little bit about the work that they do at the Community Engagement Center.
Wonderful. Good morning. I pray it is not past noon. If it is, please charge it to my mind, not my heart. But wonderful opportunity. So Tyrone Roper, director of UMB's Community Engagement Center. Senator Mccray, I want to tell you, I really appreciate what you shared. It was spot on. It reminded me of Eisenhower's important versus urgent principle. We're now in quadrant 1, which is everything is important and everything is urgent because we hadn't done enough prior to. So what you raised about the social issues are things that we can still begin to address. So I'm going to talk real briefly just some of the work that's happening within the Office of Community Engagement, of which Ashley Vallis is the executive director of. Kelly Duran is our director of the Health and Wellness Suite. I've brought with me Gemini, she's one of our community health workers, and Jared, a young man who's a senior in high school at Towson, that's really dedicated in doing this granular work in the community. having these conversations with folks that have demonstrated some ambivalence or hesitancy around getting the vaccination. So as we move on, I just really want to just uplift and let you all know, reducing the spread of the COVID virus as well as the variant is a priority of the University of Maryland, Baltimore. And we're working a lot in this capacity. That's why we're in full support of the Mask Up and Be More Careful campaign. So some of the work that we've done, so since March, we've been able to support more than 250 folks to get the vaccine. To date, we've had more than 1,000 conversations on the streets with people around getting the vaccine and really highlighting this important effort. And again, I don't want to sound coy, but mask up and be more careful. I've learned from a great mentor of mine is repetition is the mother of all skill, right? So I'll continue to convey that. Mask up and be more careful. So I've been involved in many initiatives here within Baltimore City to include approaches to reduce violence in the city, to include the decriminalization of behavioral health issues, as well as highlighting youth activities. But hands down, this is one of the most impactful and important initiatives I've ever been part of. So I too had shared a level of ambivalence around getting the vaccine. I truly had. So it wasn't until about early 2020, I became extremely ill. And temperature had arose to just above 110 degrees. I've had all the testing done, and I was completely quarantined in my room. That had to be, hands down, one of the most fearful moments of my life. And I, too, am a hood boy that's been saved by grace, so I say that unapologetically. So I've been shot as well. I was more fearful of being ill than I was the trauma that's happened to me through violence. So I really want to continue to echo and to uplift the importance of please mask up and please be more careful and have the courage to have conversations with folks on the street, to get vaccinated. Have the courage to have those conversations. Just as you have the courage to have conversations around will the Ravens beat the Eagles, right? So I add that humor just to kind of lighten the moment, but I really am saying to you all, be okay with having these hard conversations. I would like to, if it's okay for about 30 seconds, have Gemini come up and just talk a little bit about the work that you've doing out on the street.
Yes, hi, good day everybody. I'm one of the outreach workers with the University of Maryland Community Engagement Center, and I'm also one of the short people here. So myself and Jared, just as well as several other outreach workers, we go out into the Baltimore City communities to try to engage with people to see the reasons why they may haven't wanted to get the vaccine. And I'm just going to be truthful. I'm one of them, and I still feel some type of way, but I got to get over that because I recently got custody of my 8-year-old godson, one of my godboys, and he can't get it. So 8 years speaks for itself. So that means he got 4 more years. I still got to protect him through the health way. So, and for those that do wear their masks, still, when we cough, still cover our mouth, even with the mask. So I'm going to just leave that. There you go.
All right, thanks. Jared, you want to share real quick before we finish up?
Okay. Hi, I'm Jared Mitchell. So, and I'm one of the community health workers. So, yeah, so like Gemini said, a main part of our job, we canvass around the neighborhood and we listen to people. Even if they're not interested in the vaccine at the moment, we tell them about the services that the Community Engagement Center offers, like health services. They can help with jobs, EG&E. They have events where we give out food and different things like that. So that can build trust and a relationship with people in the community. So maybe if they're not interested in the vaccine at the moment, maybe in a couple weeks they'll be interested just because of the trust and the relationship that was built. So that's what we do.
Thanks, Jared. Thanks.
I want to thank everybody for everything that you've contributed. I want to thank the media for staying engaged, for being present here. I want to thank our partners at Coogee Global, Harpool Associates, and Murphy Enterprises. I want to especially also highlight Sister Robin Murphy, who is a media and equity consultant extraordinaire, but also is providing hundreds of jobs during the pandemic for people who otherwise wouldn't have employment. This is stressful, this is trying, this is traumatic, and I am a preacher, so I'm going to invite Dr. Freeman to come and close us with a word of encouragement, and then I'm going to ask everybody, if you would, let's just gather for a quick masked up photograph. And I'm hoping I'm not in trouble with my vice president, who actually is in charge. Josh,
Actually, before that, I want to make sure that the press gets any questions answered that they may have. So does anyone from the press have any questions for us? Yes.
So thank you, Kate, and good to see you, ma'am. We said, I think last week, that we will be giving an update on that in about 3 weeks. So Dr. Zaraza and I will be making a final decision on that in the coming weeks, and we'll lay it all out for you once we have it.
Do we have any other questions from the press? Yep. Yes. Well, yeah, thank you so much for that question. You're with what network? Or? WBAL, okay, thank you so much. And so that's a great question. I'll take that. And so we're with the NAACP. My name is Joshua Harris, Vice President, NAACP. And so the work that we've been doing is ensuring that we are meeting people where they are and making sure that the voices that they're getting information from may not be voices and people that you know, but they're known and staples in their communities, in their families, and we believe that that is what helps spread information, that helps reduce that hesitancy. The more that they see people that they know and that they're familiar with who have gotten the vaccine, that are doing the work, and having those tough conversations in barbershops, in beauty salons, right, at home, over the football game, we believe that that is the true work that will help to engage these vaccine hesitant communities, and making sure that the work that we're doing as institutions and organizations isn't just occurring here at the press conference and on the news, but going into those communities and meeting people where they are. And that's what helps to change the narrative and transform the narrative of what's possible and what the outcomes are when people are vaccinated, and even when they're vaccinated, when they continue to wear their masks to stay safe and healthy. I think we saw one other question. Well, absolutely, that's a great question. You're with what network? I'm with Fox 45. Thank you so much for that question. And as it was pointed out by Senator Mccray, this is a long-term haul because what we've seen, the impacts of COVID-19 are direct correlation and directly related to the social inequities and disparities that we've experienced in Baltimore City. The comorbidities that make you more likely and more highly susceptible to COVID-19 are a result of social determinants of health in Baltimore City. And so this is a long haul for us as the NAACP. We've been at it for 1.5 years and we'll continue to do this work as long as necessary. Any other questions before we close out? Thank you. Pastor Freeman?
Brother President, Vice President, to all who have come here today, our mayor and leadership, state and local level, collaborative partners here in this important work. It's a privilege for me to serve also as an executive member of the Baltimore branch NAACP. The World Health Organization defines health as the state of physical, mental, and social well-being, and not merely the absence of disease or infirmity. But there are many of us here who know that there's another dimension, that the World Health Organization's definition can be expanded, that health is a state of physical, mental, social, and spiritual well-being, and not merely the absence of disease or infirmity, because much of what bothers us physically, mentally, and socially has its genesis with the inner man and the inner woman. And so clergy who are here and others are affiliated with the African American Clergy Medical Research Initiative that has as its vision to ensure that people of African descent also benefit from the emerging genomic research and science that these vaccines are based on. And as a recipient of 2 Pfizer vaccines, and as one who is a transplant recipient who got my booster last week, we are pushing the importance of this emerging science and helping our people to get good information, valid information from those who are engaged in this process. And so as we continue to mask up Baltimore and encourage Baltimore to be more safe, I said to the one who stood at the gate, "Give me a light that I might go out into the dark." And the respondent said, "Put your hand in the hand of God, and it shall be better to you than light, and safer than a known way." This is the day that the Lord has given us, that we will work while it is day. The night will come when none of us can work, but while we are here, do all we can for as many as we can, and do the best you can. God bless you and heaven smile upon you, is my prayer.
Amen. Thank you all. We'll have everyone come up and take a masked up photo so that we can be more safe. And if Ian, I know you're somewhere here, if you could snap this photo for us.
Thank you all for coming out.
Sure, you're welcome.